Do you know about the integrated care system?
No.
No. Not that much about it.
No.
A bit, not a lot.
No, I don't know.
Vaguely.
No.
No.
The idea is to mend the disconnect between hospital care, GP provision and care in the community.
They don't seem to be able to do that, do they? I don't know what's stopping them. I mean, it seems quite obvious that they got to.
It does need to change because as the generation's getting older, there needs to be more of a link between hospitals and care homes.
So the more integrated the better, I'd say, with all public services, as long as it doesn't get too bureaucratic.
It's not just about health, it's about well-being.
Accessing healthcare if you're working is extremely difficult. For myself, I'm supposed to phone up my doctors at 8:15 for an appointment. I'm in a classroom working at 8:15.
More affluent areas, maybe they've got a bit more money and you know, they take care of them as they go to the gym or they make the right choices when they eat. But I think if you can try and spread that message out to most areas, then of course that will help.
GPs can't do everything, so the more that you can have public sort of information spread about the benefits of certain ways of life and things people can do themselves to support their own health.
And you need to look at it in localities so that you can not what's right for here now. So there is a degree of a decentralisation, I think, is good.
At K&C, I had a very good Macmillan support team there that they actually told me before I knew it that I was probably going to need some mental health support. I would never have thought that myself. So they already had that joined up link.
I know it has a huge benefit to health-wise, mental and physical, being out in fresh air and open spaces.
If you started to really assess policy from its well-being outcomes, then an awful lot of things would change, an awful lot of environmental things would change. Not only is what's the GDP result on this, what's the well-being result on this particular policy?
Making sure that you don't waste so much time on meetings and information sharing, that you're actually, you're getting more of the positive sides to the negative of bigger teams working together.
The National Health Service and the integration of it with community care would reintroduce that sense of local transparency and local responsibility and local ownership.
They are looking after me as far as appointments are concerned, but nothing materialised once I've had the appointments. And there's a big waiting list, and you know. So where do we go from here?